Do you know somebody who seems sad, lonely, isolated, and alone? Many people in our country, including children and adolescents, struggle with depression. Some of you listening may have already experienced a depression or may run into it in the future. Many people in my family have struggled with depression on a daily basis. Depression is a mental disorder that affects many lives that surround us, whether we are aware of it or not. Learning about it may better another person's life. Today I'm going to inform you on the basic facts about depression, how they diagnose it, and some ways of treating it. According to the American Psychological Association, depression is in fact the most common mental health disorder. Many people look at depression as just people that are sad or upset all the time, when really there's much more to it than that. As stated in the Webster Dictionary, depression is a state of feeling sad or a disorder marked especially by sadness, inactivity, difficulty in thinking and concentration, a significant increase or decrease in appetite, time spent sleeping, feelings of rejection and hopelessness, and sometimes suicidal tendencies. According to the American Family Physician, at any given time, up to 15% of children and adolescents will experience some symptoms of depression. Once kids have reached the age of 14, depression is twice as common in girls than over boys. If you or anyone you know have had these symptoms, you should consider being tested for a depressive disorder as well as other mood disorders. From a study taken in 2007, more than 70% of children and adolescents with depressive disorders or other serious mood disorders do not receive appropriate treatment or diagnosis. Over the years, there has always been a stigma about mental health disorders. People often look at people who suffer from them as crazy, and young people who are already at a critical point in their lives socially do not want to be recognized as somebody with a serious mental or mood disorder. To diagnose someone with a depressive disorder, many factors come into play. One of the first steps is to rule out any other possible causes like various medical reasons and disease as well as side effects from other medications. Some other key factors include whether the symptoms are drug or alcohol related or induced by a stressful event from life. After all of these are ruled out, they question the person that is being diagnosed about certain things. After a young person is then diagnosed with a depressive mood disorder, they are generally then sent to meet with a psychologist or psychiatrist for further treatment. The options for treating a depressive disorder tend to vary depending on the child and the situation. Some type of medication usually treats most depressive disorders. From the Mayo website, I learned about different common types of medications. What I learned is that there are a few different kinds. Serotonin reuptake inhibitors, what are SSRIs for short, serotonin and norepinephrine reuptake inhibitors, SSNIs for short, atypical antidepressants, tricyclic and tetracyclic antidepressants. Some common examples of these are Celexa, Lexapro, Prozac, and Cymbalta. Medicating is usually the most common treatment preferred by people with depression, but the risks that come along with it need to be taken into consideration. While these young people are prescribed these medications, they are carefully monitored to watch for possible side effects. Some of these include dizziness, dry mouth, upset stomach, sleep problems, change in weight and appetite, suicidal thoughts and tendencies. While taking these, my sister, she ended up trying a few different types of medications because the first few she had troubles with and the side effects were unbearable. Usually therapy goes along with individuals using the medication. And sometimes, like if you're not medicated, you can also see a therapist. According to the American Family Physician, cognitive behavior therapy is a treatment that is used to correct false self-beliefs that lead a person to negative moods and behaviors. Many studies have shown how successful cognitive behavior therapy is in treating depression. As you have learned today, depression is a mental disorder that affects many people around us. I hope that learning about depression today can help you better identify and understand it. I first informed you about what depression is. I then talked about diagnosing it and finally how it is treated. I really hope that all of you today have learned something and are able to use this knowledge in the future.